All right. Welcome to another Vic Lombardi podcast, normally focused on prostate cancer, but we're going to widen the spectrum a little bit on this episode here with Jamie Bachman. Jamie, tell everybody your exact title for the UCHealth system.
Good morning. I'm the Executive Director for Oncology Services at the University of Colorado Hospital.
Okay, so you're not a doctor.
I'm not a doctor.
I like to fashion myself as a doctor, so at least one of us is on this podcast. How long have you been in that role at UCHealth?
I've been here for almost 7 years.
Okay.
In that role the entire time.
Beautiful. All right, so we're going to talk a little bit about what you do and why you're here. Melanoma, skin cancer. Is it a special month for skin cancer? Is this an awareness month?
This is an awareness month for skin cancer, June.
June, is it always June?
It is always June. There tend to be months that have different cancer diagnoses tied to them. This is a special focus on skin.
So the first thing you're told, well, among other things, when you get diagnosed with cancer, as I did several months ago, is that sometimes those who have cancer are prone to get other cancers. Okay, so immediately, what did I do? I wanted to check the list. All right, let's get this off the checklist. I did a colonoscopy. I went through and made sure I did my whole dermatology thing. Let's go through and look at my whole body. I went to UCHealth. I think it's on the second floor up there, whatever floor that's on. And I had them check out my entire body because I had some suspicious moles, some script itches, something on my scalp that felt out of place. And I was like, man, please go through me like a fine-tooth comb and figure out if I have anything. And thankfully, everything checked out. You, in a cruel twist of irony, not only are the executive director and not only do you deal with this stuff, but you're also a melanoma survivor.
True story. Turns out that I did not get to where I am by accident. When I was in my early 20s, I worked at a hospital and had a number of friends who were doctors. And one of them observed, which is pretty clear, that I'm a fairly fair-skinned gentleman, and he'd asked me if I'd ever had a skin check, to which I responded, "What's a skin check?" And he talked to me about going to see a dermatologist, which I'd actually never done at that point in my early 20s.
You were in your early 20s, so at no point does anybody, let's be honest, we're in our early 20s, why do you even think about that?
Yeah, young guy, no health problems, so to speak of. Generally averse to seeing doctors, even though I worked in a hospital. But he was a good friend, and he just made the recommendation, and for whatever reason, I decided to take it. So I happened to make an appointment with a dermatologist at the hospital I worked at, and they went over me with a fine-tooth comb, very much like what you described, and much to my surprise, 3 or 4 days later, after they'd popped something off that they thought might be a little suspicious, but nothing too much to worry about.
Where?
It was on my lower back.
So you couldn't even see it?
Couldn't even see it.
Did you feel it?
Not a thing.
Did it itch?
Not at all.
Nothing?
Nope. So I'm a good Midwestern kid.
Yeah.
And growing up, I did lots of things that people do when they're growing up. I spent a lot of time playing outside with a shirt off, sports, pool, mowing lawn.
Tip cows.
Tip cows periodically, although we try to stay away from that. I never got caught, so technically never did it. So did all the things that now I know were probably not great ideas. And of course, this is in the 80s and 90s when skin health was not as well publicized.
Not as well versed as it is today.
Yeah, we owned sunscreen. I'm pretty sure it was in our house, but it was very rarely on my body. And I was out in the sun all the time.
Yeah.
And so I had kind of all the risk factors of exposure, but didn't really think of that as a problem. Didn't know it was an issue. Mm-hmm. So went in, saw the doctor. She found a small lesion on my back that she thought looked a little odd. In my case, odd was just a bit of discoloration and a bit of asymmetry. Mm-hmm. But having no history, she said, it's nothing to worry about, but we're going to play safe and let's just take a little piece of it off and see. And a few days later, I got the call, which was that thing we thought was nothing turns out to be something, and it's melanoma.
And at that point, you're thinking, what is that? What happens now?
Right. So, of course, the first response was, excuse me? I think you just said melanoma. That can't possibly be right. But it was. And so I went back in to visit them and talk about what that meant. And in my case, it meant for that particular time, because it was one of many, was for them to do what they call a deep and wide excision, where they took more of the piece of my back out where that mole had been, just to make sure that they cleared the margins, which means basically they get all of what might have been bad so that they can be sure it's gone.
And since then?
So that was the start of a pretty interesting several years for me. because it was unexpected to find something like that in a guy that's in his early 20s with no family history of skin cancer. And because it was not really thought to look that abnormal, didn't itch like we talked about, couldn't see it because it was on my back.
See, and that's the thing about skin cancers when they talk about look for abnormalities, look for asymmetry and all that. They all look the same to me. Everything, you know, like these moles, they're like, what do you mean by that? It's hard for the average person to understand what that means.
Well, and that's why it's so important to do this with the doctor's help.
Yes.
So I do a lot of looking at my own skin. I have my wife helps and looks at my skin now, and we check it regularly. But I go and see a doctor. It was every 6 months. Now it's every year. And they do a thorough examination. In fact, we've gone to the extent, because I've had several of these taken off now, I think a total of 7 over the course of about 6 or 7 years. Yep.
They keep popping up?
They kept popping up. So the last one that I had was about a decade ago now. But I've had multiple removed. And so I've always been very aggressive. If they were concerned about it, because the first one was not concerning and turned out to be something.
Yeah.
If they think we should check it out, we check it out.
Have they all been in the same area?
It's been all across my chest, a little bit on my back, one of my legs. So it's been a little bit of everywhere.
I heard a story of a guy once, fellow golfer, friend of mine. You know, we play golf in Colorado. You're always exposed to ultraviolet rays that are pretty dangerous.
Yep.
And all of a sudden one day we don't see him. Like, whatever happened to him? And turns out he had a piece on his calf, back of his leg that you never saw.
Right.
But it got dangerous.
Yeah.
It got dangerous to the point where he had to shut it down for a while. And those are the things that scare me, Jamie, is these moles, these abnormalities that you cannot see unless you have a doctor's eye. So when I got my check at the UCHealth, it wasn't that hard at all. I mean, you get in the hospital gown, doc comes in, got the special light that they use and this weird stuff. And they go up and down your body. First of all, they ask you if anything itches and all that. And I was concerned about my scalp because I had this itchy portion on the top of my scalp, right? And I was like, and it felt like a scab. And I was like, what is going on? And it's been there. Like, if I were bald, it'd be a scab.
Right.
So I had the doctor immediately check that area, and it checked out just fine. Who knows what it was. But you hear so many other stories where you think it's nothing, and it turns into something. And that's why it's vital, especially this month of June, Skin Cancer Awareness Month.
Absolutely. This is the time to take a few minutes to look at your skin yourself. This is the time to take a few minutes to work with a family member to look at it with you. But realistically, if you have fair skin, if you have a family history, if you are in the sun all the time playing golf, working, swimming, whatever it is, it's a good idea to get a regular checkup. And oftentimes it'll be fine and nothing will come back, but it's so much better to catch it early like I did than the opposite and have some of the other things that you'd need to do.
Jamie, what is the process for the average Joe? Do you go to your family physician first? Do you go to a dermatologist? Where do you go your first wave here?
You can do either. A lot of family medicine doctors, internal medicine doctors will do skin checks, and they're pretty well versed at finding things that fit into that asymmetry, discoloration, abnormality. If they see something that looks concerning to them, sometimes they'll take it off, and sometimes if it looks concerning, they'll refer you to a dermatologist. Okay. We have the luxury at UCHealth of having a really good general dermatology program that you can just get into as a patient by a referral from a doctor or by self-referring. And so you can go to them or other dermatologists in the community, and they can look too. And they're trained to look for these things. They have these special lights and glasses like you talked about, and they'll go over you from head to toe looking for things that are strange.
Interesting story. I'm 26 years old. I got a job in Phoenix, Arizona. Heat, sun. And I remember one day telling my wife I had like what looked like a mole/wart, very small on my nose, and it was itchy. And I was like bothered by it, and I decided to go get it checked out. And it turned out to be basal cell.
Okay.
Now I don't even know what that means. What is basal cell?
It's a type of cancer. It's a less aggressive form of cancer than melanoma is, but it's something we'll typically treat with just a surgical procedure to remove it.
Well, that's what they did. There's an incision on my nose. You can see the scar, right? You can see a little bit of
Barely.
the scar here.
I wouldn't know if you're putting it out.
This was a long time ago. It knocked me off television for a month.
Huh.
I had to pretty gouging scar here with stitches on my nose because they had to dig and take it all out. And I remember I couldn't do television for a few weeks because it was, at the time I was scared, but I never thought anything of it. You know, I got it taken out, and then after I was like, oh, I'm good. I had not gotten my skin checked for years after that.
Well, it's interesting because having had one in the past is evidence that you're more prone to that in the future, which is the perfect reason to go there regularly, see dermatologist, and get your checkup.
Dumb question, because we're going to ask a lot of dumb questions. That's what this podcast is for.
We'll see if I have a dumb answer for you.
I major in dumb questions. Is that basal cell that they took off my nose, is there any relation at all to the growth of my prostate cancer some decades later?
Oh, gosh. Now you're probably a little
Now we're going into science.
You're a little outside of my wheelhouse in the science world. I'd have to defer that one to my physician friends. Although there is some literature suggesting that people who have one cancer are more prone to having second cancers of various sorts. Not necessarily anything to do in your particular case, but it's been shown in some studies. All
right, so I've already had cancer. I've already had something on my nose. How often do you suggest a guy like me goes in and gets my skin checked? Yearly?
Yeah, I think based on my experience and based on what the physicians that I work with tell me, you'd want to be examined on a regular basis, probably yearly. And then they'd oftentimes, if they don't find something for a period of time, tell you that you could back off until you saw something that concerned you. And so, for example, in my case, I was being examined at first every 3 months, and then it was 6 months, and then after it had been long enough that we hadn't found anything new, it went out to a year. Maybe someday I'll get out to 2 or 5 years, but it just sort of depends on your physician's recommendation.
Why wouldn't you? I mean, why wouldn't you? If you're there, why wouldn't you not get that taken care of? Well, what astounds me too is we always label people fair-skinned. I'm Italian. You know, I tan easily.
Happens to everyone.
Exactly right.
Happens to everyone.
I mean, there's no such case as this. Only these people get skin cancers. Right. Anyone and everyone is subject to skin cancer.
Absolutely.
And that's what scares the heck out of me. And knowing that you've had cancer in your system as I have, and now I'm freaked out about everything. And I know that's natural. Yeah. But I am.
It's okay, though, because it makes you more aware that things could be wrong. So it makes you more in tune with your body and willing to listen, right? So if you hadn't had that, then you probably wouldn't be thinking about skin exams and colonoscopies and things like that, because we're healthy, normal people, and if nothing feels wrong, then you don't go looking for problems.
I saw some of these rankings. Is melanoma the number one skin cancer killer? Is melanoma up there?
Oh, yeah. So melanoma is a very dangerous type of skin cancer, very easily the most deadly of the skin cancers. Okay. And it turns out because of the elevation here in Colorado, we're closer to the sun, higher UV rays. The incidence of melanoma is higher here in this state than it is around the country.
So what does melanoma do? Had you not caught yours when you did, what happens next?
Well, like many cancers, what happens is they continue to grow, and sometimes they could grow in a spot. So, for example, that mole could have gotten bigger and weirder and more noticeable. It could have, after that, spread to different parts of your body. So it could go to your liver or your brain or your lungs.
But it's still considered melanoma?
It's still considered melanoma.
See, that's what always confuses me. Like, I have prostate cancer. If all of a sudden I get cancer in my lungs, is that lung cancer or is that prostate cancer? What is that?
So I'll give you the non-doctor answer here. So this is the hospital administrator definition.
Yeah.
So cancer is an abnormal growth of cells. When cells divide like they're supposed to, they divide and they grow and then they die off and they continue to replace themselves. Cancer is when they continue to divide but they don't die off, so there are more and more of them growing in ways that they shouldn't. So this melanoma in particular, we're talking about skin cancer this month, would grow as a mole or a lesion over and over. When it spreads to a different part of the body than where it starts, so let's say it's on your arm, it's a melanoma on your arm. If it spreads to another part like a lung or a liver or a brain, it's called it's called metastasizes.
Sure.
So it spreads through your body. And so that, like many cancers, can spread through your body, sometimes without you even knowing it, which is why it's so important to catch these things early.
But the origination is skin cancer.
Yep.
But it can develop into other parts of the body, thereby lung cancer is not skin cancer, but it started as skin cancer.
And the further away that it travels from where it originally started, the more complicated it is to treat and difficult it is, more difficult to cure.
All right, so I'm glad we established that, because I speak for a lot of people who are diagnosed with cancer, like I was, and go through the initial therapy. I had surgery, and now, knock on wood, it's under control. My blood test, PSA test, comes back undetectable after 2 tests, so I'm happy.
Good.
But I feel like, Jamie, I'm in no man's land because I'm not exactly cured, and my recurrence rate is pretty risky. I had a Gleason 9,
Okay.
so they expect it. Risk is pretty high that it'll come back. So it's like, why can't we just go find it and make sure it doesn't come back? Where am I? How should I feel?
Well, so you, like I, are in a place that we call survivorship. There are lots of definitions for that, but we tend to, at UCHealth and the University of Colorado Cancer Center, think of survivorship as from the time that you get a diagnosis of cancer for the rest of your life. Even with a definitive cure, you're still a survivor of cancer. Some people have very low risk and don't have to worry about it very often, have tests periodically just to be sure, skin exams periodically just to be sure. Other people have more of a risk. And so part of what we try to do as a healthcare organization, as a cancer community, is to care for people by making sure we have those regular intervals of testing, regular follow-up with our physicians to be watching for things, and care for people beyond the medical care. So helping people get back to their normal active life, helping support them socially and nutritionally, and helping to connect them with people who have had similar experiences to talk through stuff like this. And yet, with high-risk diagnoses, there will always be things that we're watching for, just to be sure. Again, trying to catch them as early as possible, but not always being able to see them in the background.
So your melanoma, was it a grade? I mean, like I said, I told you mine was Gleason 9, very aggressive prostate cancer.
Right.
Do you have grades for what you had?
Well, it kind of goes on the depth and the size of
Okay.
it. So mine, thankfully, was pretty shallow and pretty
Okay.
small. And because it didn't go any further than the places on my skin that we found it, it was a low stage, thankfully, which means that I was able to treat all of mine with surgical intervention, so they cut them out instead of having to do chemotherapy
Sure.
or radiation. So
Well, they cut my prostate out, so I didn't have to get to that point either.
Yep.
But there's always folks, I have friends of mine who are in similar circumstances, and their oncologist recommends radiation follow-up just in case.
Yeah.
Like one of those just-in-case modes.
Yep, there are lots of just-in-case scenarios, and depending on the individual patients and the recommendations of doctors and some guidelines that we've developed, there are different combinations that are recommended.
So when you hear people say that because they have one form of cancer, they're more prone to other cancers, is that simply just the same cancer spreading, or does that mean other cancers? Like I'm more prone to melanoma, I'm more prone to lung cancer. What does that mean, the differentiation there?
Yeah, well, certainly once someone has had a diagnosis of a particular cancer, we're always very cautious and sensitive to watch for that particular cancer to come back where it was before,
Okay.
or spread from that place where it originated, right? So perhaps we had a surgical procedure that got everything, and yet somehow it still persists. Perhaps we treat it with radiation and chemotherapy, and somehow it still persists, and we're always watching for that. And so that's the primary piece. Secondarily, we do screen for cancers once someone has had another diagnosis. And there are some indications that say if during a certain time in your life you've had certain types of treatment for a cancer, that those treatments can make you prone to a secondary cancer. So,
Okay.
for example, children who are treated with radiation for certain cancers have been shown to develop other cancers later on in life. People who've had radiation to certain parts of their bodies have shown to develop secondary cancers later on in their life.
I see.
Possibly because of the treatment, possibly because of being prone to cancer. And I think those are some good questions to talk with physicians about as we go through these diagnoses to understand which applies to us as individuals.
Let's talk about age a little bit, because my cancer, prostate cancer, a lot of people deem that, that's the old guy's cancer, right? You don't get that until you're old. Well, when you get it in your 40s and early 50s, it seems to be of an aggressive nature, which
Yep.
is how you find out you have it. What about melanoma? Is there an age group that is more susceptible?
Younger than prostate cancer for sure, but still not as young as my experience. So typically, I believe the age range where you're most susceptible will be probably in your early 30s to mid 50s.
Okay.
And so you've had enough sun exposure over
Sure.
time to have a risk.
We've talked about melanoma. We've talked about my basal cell. How many different skin cancers are there?
Those are the two primary.
Those are the ones that are concerned.
The two primaries that we really take care of.
All right.
There are other precancerous lesions that we'll remove from people. Some that we call dysplastic nevus, and so those are moles that look like they could be atypical, look like they could develop into cancer, but they're not cancer yet.
Running the oncology unit, what do you do?
So
you make the schedule?
Check people in, make the schedule.
Yeah.
So like I said before, I'm not a doctor, but my job is to make sure that the doctors can do what they do every day.
Okay.
My job is to make it a great place to work. My job is to make it a great place to be cared for as a patient, and to create a setting where we can have tremendous outcomes so our patients get cured of cancer.
You do this with a smile, and I love your attitude. Is it hard to do that sometimes? I mean, we're talking about cancer here.
Yes and no. We deal with a very serious diagnosis every single day at our institution and other organizations like ours. But the people who choose to do this do it because something called them to do it. The doctors do it for a reason. The nurses do it for a reason. People like me who are non-clinicians do it for a reason. Being able to help people in circumstances like this is really gratifying. And so when I think about doing things outside of helping cancer patients, I could certainly do it, but I don't know that the smile on my face would be as big every day.
Yeah.
This is something that's rewarding to me. I know it's helping people. It can be fun, even though it's not really the greatest circumstance to meet people in.
Yeah.
I like to tell people that I interact with at our cancer center, I would have loved to have met you under different circumstances, but since this is how we know each other, let us do our best. Thanks for trusting us with your care. We're here to help you.
Well, one of the reasons I chose UCHealth with my diagnosis is because you guys made it so easy. It was essentially I don't want to compare it to a buffet line, but I didn't have to go elsewhere. I didn't have to, go do an MRI here or go do a biopsy there. Everything was done right there, essentially under one roof. And for me, that was comforting. So you have, like where I went to the urology clinic.
Right. Then
above that, you have the radiation area. You have the dermatology. I mean, how many different areas are there in that one place?
So the Anschutz Cancer Pavilion out on the Anschutz Medical Campus is a building that houses specialty physician practices for all types of cancer. And we've chosen to group those together by disease site. And so surgeons and chemotherapy doctors and radiation doctors all practice together around one diagnosis. And that's where we try to do what you just described, is make it a one-stop shop so someone can come and have tests, see all the doctors that they need to, see all the nurses that they need to, and get all the treatment all in one building. And so we have 13 specialty groups in our particular building that we focus around different cancer types. And our goal is to get people in to see our doctors very quickly, to develop a plan of care and start it as quickly as is necessary, and then help make it an easy journey for folks.
So when I did my reading on attacking this, it always listed, hey, make sure you get your team together. They always mention team. You got your urologist, you've got your oncologist. So I have my doctor, who I see most of the time, Dr. Maroney there, but does he serve as my entire team? Or how does that work at your place?
Yeah, so at our place, all of those doctors work together. So the oncologists, the urologists, and the radiation doctors are actually the core part of the team. They're talking constantly.
Okay.
So when a patient comes to see one of them, it's not uncommon for all three of them actually to interact with patients, depending on the circumstance. Even when they don't interact with the patient altogether, they're talking behind the scenes.
Sure.
And more importantly, it's not just them, because they rely on things like lab tests that have some expert opinions that are rendered by pathologists, reading of biopsies that are rendered by expert pathologists in specific cancer types, radiologists who train just to read films about a particular part of the body. And so the teams are comprised of certainly the people who you would see in an exam room, who would be there having conversations as a patient, but the teams are so much bigger and so much more complex because they rely on a great number of people to help support them.
Interesting. What about the notion, because I've always had people ask me, have you gotten other opinions? Have you sought out other doctors? Have you sought out other practices? What is the general reaction? if somebody wanted to go elsewhere just to double check.
Yeah.
How do you guys respond to that?
It's not uncommon. We support it, and at the same time, we love to keep people in our system of care. We find oftentimes that when people do go out and find a second opinion, one of two things happens. Either they go and get an opinion, and it's very much like what we offered already, and so they come back because they were comfortable with us. Or
Is it considered offensive, though?
I think that's an individual physician response, but we as an organization tend not to consider it offensive, and oftentimes our doctors will say, if that makes you more comfortable, please do.
Sure.
Here are a few people I might recommend talking to.
Okay.
And that might be someone in town, it might be someone in a different cancer center that's like ours around the country, and some of these bigger academic centers. But we tend to see people go and come back because they like the style of care, they appreciate the team nature that you described, it's convenient, and there's not a need to travel.
Here's some of the hoops you have to jump through with insurance companies and oncology. I'm finding this out, and I just wonder how difficult it is from your perspective, because like if you want to take a certain scan, well, you can't take the scan unless you show this much on your blood test, and you got to wait till you get. And I guess my reaction to that, wait a minute. I have to wait till I have more cancer to get a scan to remove the cancer? And we're confused as patients, as survivors.
Yep.
It's very humbling, confusing, and aggravating.
It is, and it's equally aggravating to the clinical teams who want to recommend doing some of these things, and we're in the background oftentimes doing battle with our friends at the insurance companies. I choose to believe at the heart of it, they're all supporting us and working together to make sure patients get the right care, but it's not without a lot of effort on the behalf of the patients, on behalf of the clinical teams to get this stuff to happen.
Good to hear. Wrap this up with, now that you are a survivor, you've had some melanoma cut out of your system. You ever see people walking around and you say, ooh, do you ever recommend that stuff?
I did one the other day, actually. I was standing in line on a water slide in Columbus, Ohio, when I was visiting my parents, and I saw something on the back of a guy in front of me. I said, you should probably go get that checked out.
Good for you.
Hopefully it did.
See, and I'm doing the same thing. That's why we're doing this podcast.
Yeah.
You know, it's not like I can see if you have prostate cancer, but at the same time, you know, younger people who don't think they're susceptible to this stuff at all. I mean, it doesn't hurt you to get that blood test. It doesn't hurt. It doesn't hurt you to, if you go to your physician, hey, can you check this out, by the way? Just ask questions. And the thing about men's health specifically, men sometimes, we're too damn proud. And we won't get outside of our proud zone, as I call it, to have people check.
Be self-aware, allow yourself to be vulnerable, go see people who can help you. I know that I fall into this category too, and I have to remind myself constantly that unless I'm looking after myself on a regular basis and asking other people to help me, I'm putting myself at risk by not taking care of myself. And so for just about anything, this is well beyond cancer. The sooner you find something wrong, the better chance you have to fix it. And so whatever that is, if you don't feel right, look right, sound right, and you feel that having someone else help you understand what that might be, working with your local physicians and working with your clinical team to help find out what those problems are is a really important thing to catching bad things early.
How many gallons of sunscreen do you apply before heading out?
Oh my goodness! I'm an avid sunscreen user. Yeah. They say it's not particularly helpful above 30 SPF, but I'm caked in my hands every day I walk out. Never go out without it. And
I'm ashamed to say, Jamie, I'm the guy who for a decade plus said, I'm Italian, I'm good.
Yeah.
And I just never even bothered, even after the basal cell incident. Even after that, even wasn't enough to scare me into it. Now, different story.
Yeah.
Different story.
It's important, and it's not going to stop everything, but it's certainly going to give you a layer of protection that you wouldn't have otherwise.
All right, so month of June, Skin Cancer Awareness Month. Besides being proactive and seeing your doctor, you guys doing anything special to help people?
We've got some screenings going on around the community.
So if you hear about a screening, show up, because that's a free opportunity.
Yeah, if you hear about a screening in the community, whether it's at UCHealth or otherwise, please do go. Work with your family physician to get a screening. If you happen to have your wellness or other visits coming up, if you haven't seen a dermatologist ever and any of these things we're talking about resonate to you, check with them about that. And there's another resource in the community you'll probably see driving around the state over the next several months called the Sun Bus. They are an organization that has a mobile unit where they're doing mobile skin cancer screenings throughout the state.
Oh, wow.
We'll have them at a couple events that we're doing through UCHealth over the course of the next few months, and they're working with organizations all over the place just to make it practical and convenient for people to have these skin checks on the fly.
Look for the sun bus, everybody. Jamie Bachman, UCHealth. Thanks, buddy. Appreciate it.
Thank you.
Good stuff. That was awesome.